Hello, hello, everybody. Welcome back to Speak Out. I am Christine Yeargin, your host, and I am getting ready to head to the airport because it is the Super Bowl for pro-lifers this week. Actually, next week, technically, but I have several events before I get to Washington, D.C., so maybe we'll consider that the playoffs. It's a really exciting week, and today's guest is phenomenal leading into that. But I want to let you know, if you are in D.C., for the March for Life, or you happen to be in the area, maybe you're in Maryland or Virginia or something, you can join us at the National Pro-Life Summit, which is the day after the March for Life, January 21st. And we would love to have you. You can hang out with me and other amazing speakers. We have Allie Beth Stuckey, we have Seth Dillon, we have Tony McFadden, obviously Kristen Hawkins, Isabel Brown is going to be there, Autumn Higashi. You're going to love all of the speakers that we have. You can grab some cool merch like this. For those of you who are watching on YouTube, you can see I'm wearing a Students for Life sweatshirt. It says, it says equally human, born and preborn. I'm traveling in this today, so hopefully I get some comments or conversations started because of my sweatshirt. But today's guest kind of is perfect leading into this whole pro-life week that we have coming up. And I've had requests to have an OBGYN on and talk to them about, the development of a baby or abortion as a whole. And I wanted somebody who was not just a pro-life OBGYN. And I don't say just in a bad way, because we need as many pro-life OBGYNs as possible. But I mean, somebody who knows about abortion specifically very in depth. And I was able to snag Dr. Anthony Levatino for an episode, and we get to talk to him today. And the special thing about him, he is a pro-life OBGYN, but his story is so incredible because he used to perform abortions. He's always been an OBGYN. He wasn't an abortionist per se, where that's all he did, like some of the people at Planned Parenthood or, Warren Hearn here in Colorado, or Kermit Gosnell, or, those names who have just done abortions. He was an OBGYN, so he's got that side of it. Still, teaches to this day and knows everything under the sun because he's done this for many, many years. But he also performed abortions, over 1,200 abortions, and then eventually had a change of heart and became pro-life and started speaking out against this. And while he does teach, he also has done given testimony in Congress and talked about what this really is, what abortion actually is. When they say reproductive rights, or a woman's right to choose, or my body, my choice, all these euphemisms that they use obviously are covering up something. What does that actually mean? Let's talk about what it means. So I asked you guys your questions, what you would have somebody, or what you would ask somebody who was really informed on abortion. And many of you said, how do you sleep at night? Which is not a question I asked him, because he's an incredible man and obviously regrets some of the things that he's done in the past, which I think we all do. But you asked questions like, does this harm the woman? Is abortion actually safe? What happens if the baby survives? We're talking about all of that and more. And I'm so looking forward to you guys hearing from him, because he's very candid with it and just says it like it is. And this is an episode that may or may not get banned on YouTube. So I'll definitely put it on Rumble as well, because I want you to be able to see it if YouTube or Apple or Spotify takes it down, because we're going there. It's raw, it's real, and I can't wait for you guys to check it out. So here we go. All right, Dr. Levatino, thank you so much for joining us today. It is an absolute pleasure to have you.
My pleasure, Christine.
So I am very intrigued by your story, because we hear all the time that people who are pro-abortion or pro-choice, whatever you want to call it, that, that they don't change their mind, or it's not a baby, or it's this or that. You obviously, you're an OBGYN. You have provided abortions at a period of time during your career. And so I'm so curious to you. I want to hear a little bit about your story. We'll jump into the shift, the mind change later. But when you became an OBGYN, you went to school, what made you decide to want to perform abortions? Because not everybody performs abortions who's an OBGYN.
I'll be happy to answer that question. But the thing I'm thinking of right now when you posed your question is that it is totally untrue that people that are into abortions virtually never change their mind. Lots of them change their mind. There's been plenty of literature put out over the decades about the crisis in abortion because so many doctors who had been doing abortions for years were suddenly not doing abortions anymore. And I will tell you my story, but there are a couple of more stories I will tell you at the end if you're interested about other people that had different experiences that I know of who walked away from the abortion business. Something else that's important to understand, many people think that, well, just about all these OBGYNs do abortions. That is not true. There have been 3 peer-reviewed published articles in the last 10 years looking at the number of OBGYNs who are doing abortions. And the numbers are very consistent across the 3 studies. And they average out that 85% of OBGYNs refuse to do abortions. So you don't get the idea that every OBGYN is an abortionist, because we're actually in the minority. Now, for myself, I graduated from medical school in 1976. That was only 3 years after Roe v. Wade and 6 years after abortion had been made legal in New York State, where I was doing my residency. And at the time, if you asked me how I felt about the abortion issue, I would not have hesitated for a second to say that I was pro-choice. This was a decision between a woman, her doctor, and no one, in particular the baby's father, had anything to say about it. A lot of people identify themselves as pro-life or pro-choice. For many people, it doesn't affect their lives directly. It doesn't even affect how they vote. But when you're an OBGYN and you say you're pro-abort, that's not just some vague political position. Then you have to decide whether you're going to actually do those procedures. So right along with learning in my residency program to do deliveries and hysterectomies and all the things that OBGYNs do, I learned to do first and second trimester abortions.
And you just...
the thinking was, this is care that's available to women. I have no moral objection to it, so I'm going to provide that care. It was that simple.
Wow. I to what you said earlier, that people don't change their minds, I was kind of speaking more from a pro-abortion stance, where that's what I often hear is that, especially, abortionists don't change their mind, or women don't change their mind, especially women who have had an abortion and maybe later regret it. They're kind of shunned to the side, and they'll raise them up if the woman is praising her abortion, but the minute that she regrets it, all of a sudden she's an outcast and they want nothing to do with her anymore. When you were doing abortions, did you have to leave work at work and not think about it at a later time? Or was it something that you often thought about once you got off work? I mean, obviously you're seeing little babies that are coming out. Was that something that registered with you at that time, or it just was, another procedure?
Well, in a very great way, it's just another procedure. And I know that sounds callous, but that is pretty much what it was. And I know that confuses people. How can you as an obstetrician be delivering a baby 1 minute and then an hour later you're doing an abortion? How can you do that? Because I think you compartmentalize what you do in your mind, and you see it as just part of the job. And so there is, if you don't have any moral qualms about abortion, I didn't get a sense anyway of this big conflict between, gee, I'm doing a delivery and gee, I'm doing an abortion, because that lady wants her baby and the other lady does not. Therefore, I'm going to take care of them both.
Yeah, so you just saw them as your patients, and this is just a typical procedure that you do. Can you, for those who don't understand exactly how abortion is performed, and I know there are multiple types, but as briefly as you can, maybe go over each type of abortion and just like a couple sentence overview for each one.
Yeah. At this point in time, 50% of abortions are done with medication, chemical abortions with mifeprex or RU486, and 50% of these, we're talking first trimester abortions, up to about 12 or 13 weeks from last menstrual period, and another 50% of them are done surgically as suction D&C abortions. When I did my training in the late 70s, there were no chemical or medical abortions. That was in the future. In a suction D&C abortion, a surgical first trimester abortion, You use a suction machine, and a plastic tube is placed inside the cervix is opened or dilated. A plastic tube is put inside the endometrium, and then you turn on the suction machine. It's quite a powerful suction. And these abortions in the first trimester, to get a picture of this, literally look at the width of your hand. That's the width of my hand. That would be from head to rump, a baby at 12 weeks from the last menstrual period. So a baby for these first trimester abortions are this size or smaller. They're fully formed. They've got arms and legs and everything else. The suction machine, when babies are this size or smaller, the suction machine itself is powerful enough to just pull the baby apart. And so you use the suction catheter to suction out or pull out the baby, the afterbirth, the fluid, everything else that's in the uterus. When the procedure is done, there's a kind of a stocking inside the vacuum machine where the solid material, i.e. the baby and the parts, are collected, and you literally have to open that up and go through it and more or less take inventory, make sure that you got 2 arms, 2 legs, and all the pieces. It's very important that you not leave tissue behind. That's a suction DNC first trimester abortion. Medication abortions with Mifeprex or RU46 are approved, not done, but approved up to 10 weeks from the last menstrual period. And in this case, a woman takes Mifeprex or RU46, a pill, and then 24 to 48 hours she gets a second medication called misoprostol or Cytotec. That the Mifeprex or the RU46 kills the pregnancy, and the misoprostol or Cytotec given 24 to 48 hours later induces contractions that causes the uterus to contract and expel out the products of conception. That's the professional term, basically baby in afterbirth that has died as a result of using the Mifeprex. So basically an RU46 or a chemical abortion induces a miscarriage. A woman goes through basically the same thing with a medical abortion as she would with a spontaneous miscarriage. She can get cramping that can be severe. She can get bleeding that's moderate to heavy, sometimes very heavy. Bleeding, by the way, averages something like 16 days. It can go longer. She will tend to get nausea, vomiting, syncope or fainting feelings. This is a result of the combination of medications. This is in a high percentage of patients. And eventually it brings on a miscarriage. Roughly up to 8% of medical abortions fail, and they need to be completed using a surgical abortion. So this is part of it. I know that people like the idea of a medication abortion because it's private, and this can just all happen at home. But there are a possibility of complications, and as I said, upwards of 8% of these end up as surgical DNC abortions anyway. There are actually fewer complications with surgical or DNC suction abortions in the first trimester than there are with medication abortions. After 13 weeks, and I did abortions, now remember I said 12 weeks was the width of your hand. After 13 weeks, and in my case up to 24 weeks, you are doing a different procedure, and the procedure we do is called suction DNE. Commonly it's called a dismemberment abortion. And as I've described this to people, I warn anybody listening, this is going to be graphic, but I promise you it's absolutely accurate, and it's firsthand. Imagine a baby 20 weeks along, and this, remember, we did this in a range from 13 to 24 weeks. Imagine, for illustration in this case, that the baby is 20 weeks along. Her uterus is all the way up to her umbilicus. Now remember I said the width of your hand was 12 weeks. A 20-week baby is the length of your hand, from the tip of your middle finger to your wrist. That's head to rump, 20 weeks, not counting the legs. She's been feeling the baby kick for the last week or two, but now she's asleep on an operating room table. Well, she may or may not be asleep, because sometimes she's now done in clinics with local anesthesia. I always did them in a hospital with general anesthesia because it was safer. I know that someone would argue, a doctor would argue and say, well, general anesthesia is not so safe. I think it's safer in a hospital setting with a trained anesthesiologist watching over your patient should a complication occur. I won't get into that, but yes, they can sometimes occur. But anyway, you've got this baby that's as big as your hand. 24 weeks would be a little bit bigger than that. And you have and after, in this case, you use the suction again, but in this case, just to take out the fluid that's around the baby. The babies that are that big don't fit through these catheters, they're only about this wide. So you have to dismember or pull the baby apart. And you use a long clamp called a Sofer clamp to do it. And picture yourself reaching in with this clamp. Now, the way I did them was blind. I didn't try to use ultrasound. Ultrasound, frankly, doesn't help that much. It can be used, but I didn't. Grab anything blindly you could and pull, and I mean really hard, and out pops a leg about that big, which you put down on the table next to you. And then reach in with the clamp again and grab anything blindly and pull as hard as you can, and out pops an arm about the same length, which you put down on the table. And then you go in with that clamp again and again and tear out the spine, the intestines, heart, and lungs. Head on a baby that size is about the size of a plum. You can't see it if you're not using an ultrasound, but you've got a pretty good idea that you've got it if your clamp is around something and your fingers are spread as far as they will go. And you know you did it right if you crush down the clamp and white material runs out of the cervix. That was the baby's brains. And now you can pull out skull pieces. Sometimes a little face comes back and stares back at you. And again, after a D&E abortion, just like with the D&C abortion, you have to take inventory. You have to make sure that you get 2 arms, 2 legs, and all the pieces. Because if you don't, your patient will come back infected, bleeding, or dead.
Wow. I have heard all of this, and I know all of this because I've done a lot of research on it, but it also, like, hearing you say it, knowing that you've seen it, also makes me want to throw up. I mean, it's awful to even think about. I'm curious, when you saw those pieces and parts, did you ever think, like, oh, here's a little hand that will never get to hold his mother's hand or her mother's hand? Or did you ever, just nothing? You were in that frame of mind of, I'm just helping my patient.
As I said, you compartmentalize. It is part of medical training. As a physician, you need to separate yourself emotionally from your patient. And we're not going to talk about abortion, delivery, hysterectomy, anything else. I know that this woman is somebody's wife, somebody's mother, somebody's sister. I know that she may have children that depend on her. But for that hour or two in an operating room, it sounds crude, but basically she's a collection of nerves, artery, muscles, and bone, and I'm there to do a job. And again, emotional distance is almost a necessary part of the job, but sometimes I think we do it a little too well, and this is exactly what you're asking about. But when you're a dedicated pro-abortion physician and you think this is an okay thing, you learn to ignore it. Believe me, when you first do an abortion the first couple of times, it's yuck. This is legs and arms and pieces, and especially, and I had done a lot of first trimester abortions before I ever did a suction D&E abortion. And the first time I did one of those, it was like, wow, this kind of gets to you. But believe me, from personal experience, you can get used to anything if you do it often enough.
Yeah, that's conditioning. That's an unfortunate thing about our mind is that you can kind of condition it to do anything or think that you're helping people even if there's harm happening at the same time. I'm curious, when the women came in, did you ever talk to them? A lot of times I hear the women say that the abortionist never talked to them. They only talked to the nurse. Did you ever speak to them?
Absolutely, all the time. Now my situation was a little different. If I'm running it, and I did not run an abortion clinic. My partners and I, we had a regular OB/GYN office, just like most women who are listening to this have been to. And we did everything. We did deliveries, we did hysterectomies, we did everything, and abortions. Okay, but we did everything. If I own an abortion clinic and the only thing I have to sell is abortion, and the patient walks out on me, I don't make any money. In my practice, if you want to have an abortion, I'm going to take care of you. If you want to have your baby, I'm going to take care of you.
You get
So,
paid either
there was
way.
no, no matter what decision she made, I'm okay with that. We were very careful. Again, the legal requirements are one thing. For instance, in New York State where I was working, it was perfectly legal for me to do an abortion on a minor without discussing it with the parents. I think this is absolutely horrendous. Even as an abortionist, I thought that was horrendous. So even though
Yeah,
that's
I
what the
agree.
law allows, that doesn't mean as an abortionist you have to follow that. Even though our whole office was dedicated to the idea of abortion. Um, Either our nurse practitioner or the physician himself would talk to the patient, counsel the patient. We were very careful to ask patients why they were having the abortion because I didn't want to ever be in a situation where where someone was being forced or pressured into an abortion by somebody else. We did ultrasounds on every single one of our abortion patients because estimated gestational age based on last menstrual period alone can be really unreliable. And I don't want to think that I got like a little 8-week pregnancy when I've really got a 13 or 14-week pregnancy, and we can end up in trouble with that. So we did ultrasounds on all of our patients. It was not required, but it was part of our care. And so the situation was a little different than an abortion clinic because, as I said, this was our office. Oh, and I was talking about minors. And even though the law would allow me to do an abortion on a minor without parental consent in New York, no way in hell. We had an office policy that was hard and fast. If you are 17 years of age or younger, you will need your parents now, at least one parent's knowledge and consent before we will do an abortion on
Hmm.
you. I mean, that just to me is good medicine. You do not touch people's children without them knowing about it.
Amen to that. I mean, obviously, we're seeing something different. And like you said, you had other income coming in because if a woman chose life, you're still getting paid, you still have a
Yeah.
patient. So it's not that big of a deal. But when we talk about this kind of stuff with Planned Parenthood, it's better for them to not have parental consent because abortion is their main stream of income. That's their moneymaker, their bread and butter.
Let me make one more comment about that. On the flip side, after the abortion, it's different in when you have your own office too. You will hear abortionists will tell you all. When we talk about possible mental problems or concerns after abortion, and so many in the abortion industry and even the American Psychiatric Association will sit and tell you, "Oh no, there's no such thing. There's no mental problems after abortion." Or abortionists will tell you, "Look, that's baloney. When I do an abortion, I go in to see that patient. The first thing I see on her face is relief." They are not lying. That is exactly what you see when you first see them. Abortion is not a convenience. Pregnancy is not a convenience. So no one should ever talk about abortion being for convenience. There's no such thing as a convenient pregnancy. And women are very heavily pressured, not necessarily from outside, but just internally, in terms of getting an abortion. And they're under tremendous stress. I don't want my dad to know I was sexually active with Johnny. I'm worried about my education. I'm worried about my finances. There's all kinds of things that may drive a woman to have an abortion. So when the abortion is done, the abortionist is not lying. The first thing they see on their face is relief. The pressure's off. The pregnancy's over. But when you're running an abortion clinic, the odds are typically slim to none that you're ever going to see that patient again. In my practice, I would see most of those patients, for years into the future. These were my patients. So, yeah, the first thing I saw was relief, but it was only afterwards that suddenly it was like, wow, I know when my baby's birthday would have been, around what date, or I see a child on the street that's the same age my baby would have been if I didn't have the abortion. Or, most of those kind of thoughts come after the pressure is off, months, years after the fact. And that's something an abortionist in a clinic never sees.
Oh, that's tough. That makes me tear up just thinking about that. When you had patients coming in, did you ever have them change their mind, say they're ready to get on the table and have an abortion, and they're like, wait, I can't do this. I'm not going to go through with it?
Occasionally, it happened. And again, it was like, hey, no problem. Let's get you set up for prenatal care or an adoption or
Yeah.
whatever you want. It occasionally happened, sure.
So what was the time? So your story is very interesting because you provided abortions and now you don't. And you speak out against them and you tell the truth about them, whereas a lot of people try to hide what actually happens in an abortion. And I'm speaking specifically about the abortion industry, people who profit. But what was the moment where you changed your mind and you're like, you know what, I can't do this anymore. I'm done.
As I said, when I'm done, I'll share some other stories, but my story was a little unique. I met my wife when I was in my first year of training at the hospital. She was a renal transplant nurse at the time. We dated, married, and like a lot of young couples, we wanted family of our own, but found out pretty quickly that she had an infertility problem. She went through an extensive workup, and we were basically told, I think and this is from an expert, I think your odds of having a baby of your own are slim to none. And that's that. And after we got over that shock, we decided, like many couples, we'd be happy to adopt a baby. I mean, we would be very happy to adopt a baby and raise that child as our own. Anyone who's tried to go through the adoption process knows how difficult it is. We went to religious agencies, we went to state agencies, we went to county agencies, we went everywhere we could, and the best we could do after months of effort was to get on a waiting list, a 5-year waiting list to get on the actual waiting list. And it was during that time when we were trying to adopt a child that I had my first doubts about abortion. It was strictly selfish. I'm not an idiot. The reason that there are no babies to adopt are people like me grinding them up in suction machines at the time. And I remember doing abortions. Still, I was dedicated, but I remember doing abortions at that time and thinking, gosh, I'm throwing these kids in the garbage. Wouldn't even one of these parents allow us to take their child home and raise as their own? But of course, it doesn't work that way. Months after, during that process and all the frustration that came from it, I came up with what my wife still credits as the best idea I ever came up with in our whole relationship, other than my asking her to marry me. And that was, this is stupid. We're getting nowhere on the normal channels. I know 50 obstetricians on a first name basis. Let's advertise. And we did. We let them all know we were looking for a baby, and maybe we'd get lucky. And sure enough, in August of 1978, we were notified that there was a 15-year-old girl in labor in the delivery room who had had no prenatal care, who wanted to give her baby up for adoption. And we were blessed to be able to adopt a little girl that we named Heather. Fantastic. We've got a baby now. And after all the tears and after all the doubts, we had a baby of our own. And my wife got pregnant the very next month, all by herself, without any help. And our son Sean was born in July 1979. So I've got a son and a daughter now. I've got the proverbial millionaire's family. And any doubts I had about abortion simply evaporated, and I went back to business as usual. Sean and Heather were figuratively and literally close. They were only 10 months apart. But as I said, I've got a son and a daughter now, and as I said, I just went on with my business. On June 23rd, 1984, exactly 2 months away from her 6th birthday, Heather was killed in an auto accident in front of our home. Anyone who has children and is listening might think they have some idea of what that feels like. But unless you've lost a child of your own, you have absolutely no idea what that feels like, and I hope you never find out. But what do you do after a disaster? You bury your child, you take some time off, and then you try to get back into your life. And I don't know how long it was after Heather's death, a few weeks, but I showed up at the hospital to do a second trimester D&E abortion. It was nothing special, this was routine. And it's the same abortion I described earlier. And I reached in with that sofa clamp and I ripped out an arm or a leg, and I just stared at it in the clamp, and I got sick. But like I said earlier, once you start an abortion, you can't stop. You have to make sure you get all the pieces, or your patient's going to be in serious trouble. So I finished that abortion, and I know that it sounds strange to people, but I promised everyone earlier that what I'm telling you is firsthand and true. After all those years and all those abortions, and at the time, this was mid-1980s, 1984, at the time, for a late second trimester abortion like this one, we were charging $800. That is the equivalent today over $2,300.
Wow.
But for the first time in my career, I looked. I mean, I really looked at that pile of body parts. It's what you were asking before. Now I looked, and I didn't see her wonderful right to choose, and I didn't see what a great doctor I was helping her with a problem, and I didn't even see the $2,300 cash I just made in 15 minutes. All I could see was somebody's son or daughter, and that was the beginning of the end for me.
Oh, I am so sorry about your loss. I cannot, like you said, unless you've been through it, I can't imagine. I think I can imagine, but I can't. And that's absolutely devastating. I'm so glad, obviously, that you changed your mind and now that you're on our side and you're speaking out about this and you're telling the truth behind what you saw. And gosh, I can't even stop thinking about that.
Let me tell you a couple of quick stories because I said lots of people changed their mind. A lot of
Okay.
us got into abortion early on in the late 70s when abortion was new. Okay, we're young and we're going to save the world, as so many young people are going to do. We're no different. We were idealistic when we were younger.
Of
And
course.
a friend of mine, his name was Steve, a colleague of mine at the medical center, dedicated pro-abortion physician, did abortions for years, didn't go through what I went through, but was after years of doing them, literally was, remember I said you had that little stocking in there and you have to take it out and check the parts? Literally,
Yep.
he was looking through the parts one day and I don't know what it was, it just hit him. It was like, what the hell am I doing? And he stopped. He quit.
Yeah.
Another physician in our town, again, dedicated abortionist. Very interesting. There was a lady in our town who was, years later, we joined a pro-life group when we got involved in pro-life. And there was a lady in that group that was who was a kind of a pro-life jack of all trades. She was a widow. And if you needed something to do, she was the one to do it. Stamp envelopes, make phone calls, whatever. But there were two things she did that were really unique. And they were her own. They were her own idea. One was she had found the name, and there were plenty of abortionists in Albany, but for whatever reason, she'd heard about this one particular abortionist, happened to be one of my colleagues at the hospital. And she prayed for that doctor every single night by name for months and months. And she did something unusual. She found the name of the abortionist's wife and his children, and she prayed for them by name every night. This was just something she did on her own. The other thing she loved to do was to go into junior high or high schools and give pro-life presentations. She was scheduled to do a presentation like that one day, woke up sick as a dog, tried to get a substitute, couldn't find one, so dragged her butt out of bed and went into school and gave the presentation. That night, one of the young ladies she was 13 years old, who had been in the class, it was in 8th grade, sat down at the dinner table with her parents and got the usual question from mom and dad, what did you do in school today? And she proceeded to tell them about this pro-life presentation that the woman had given, and it really impressed her. And she looked at her parents when she was done describing it and saying, I just can't understand how any doctor could do that to a little baby. Well, unbeknownst to her, her daddy was an abortionist. And as it turned out, he was the abortionist that the woman had been praying for. And that little
Oh,
girl was the little girl that that woman had been praying for months. And God honored that, put her in front of that child. And then that child, totally unwittingly, went and witnessed to her daddy, who was so afraid that his little girl would find out what he did, that he quit and never did another abortion after that. There are lots of
I
stories
love
like
that.
that.
I love that. That is so cool. Look at God. I mean, every time I hear stories like this, and obviously not abortion related, but just stories in general where you're like, only God could orchestrate something like that. It's just so cool and so powerful to see the ways that He works and the people that He uses and how powerful prayer is. I mean, obviously, we need her and everybody else to be praying for Joe Biden and everyone in Congress. We need to have all of them wake up. There was something that went viral a little while ago, not too long ago. The Guardian shared it and it blew up. And it was basically, they called it the issue of tissue. I don't know if you remember that
I'm sorry, it was the
recently.
what?
They, it was called the issue of tissue.
Oh, okay. No, I don't recall seeing
Um, and basically they showed a picture of like a petri dish, and said, like, this is what an abortion is. I want to say it was like at 9 weeks or 10 weeks or something like that, but there was no baby in there at all. It was
They're
just
teasing.
kind of the leftover, looked like a spider web, kind of like just white tissue. They said, this is what a pregnancy is when you're removing it. Is that true? Or can you see a baby at 8 or 9 weeks, 10 weeks?
At 10 weeks, all right, we said earlier, a baby at 12 weeks is the width of your hand. That's
Right.
head, arms, legs, 10 fingers, 10 toes, beating heart, been kicking actively for at least 2 weeks. At 9 or 10 weeks, you still have identifiable arms, legs, toes, fingers. Okay, so
Right.
as far as the pictures, I can't comment because I didn't see it. The first thing I
I'm
would
trying to
know
pull
is
it up right now
how do
for
we
you.
know how do we know what gestational age this pregnancy was? Was it even accurate? And two, was the baby small enough that the machine basically homogenized all the tissue? You know what? It doesn't really, and I know that many people on the pro-abortion side take a lot of comfort in this idea. Well, it's not a baby; it's just a fetus. Um, you know something? When I talk about this, or when I give a presentation, yes, fetus and embryo are accurate scientific terms, but the way they're being used by the pro-abort side is to dehumanize what we're talking about. So I always use a term based on my own experience that is always correct at all stages of pregnancy, regardless. This is your son or daughter. You know, today, and I tell people,
right.
you, Christine, you're an adult today. Once upon a time, you were a child. You didn't look anything like you look today. Once you were a baby. Once you were this big. But it was always you.
Yep. I want to show you. I don't know if it'll work. And if anybody's listening, they won't see it. But if you're watching on YouTube, I'm going to try and do my best to put my phone up to the camera and show you a picture of what it looked like. Let's see if this works.
You're going to make me put my glasses on. It's a little fuzzy. Nah, I can't. Yeah, you know, they're just showing clumps of tissue. But again, what does it prove? What are they trying to prove?
That's what a baby is at
But
9 weeks.
that seems to be an extension of that old thing from years ago. Oh, it's just a clump of cells. Well, that died years ago. And you know what? Any 10-year-old knows enough to access the internet and can get pictures of babies at various stages of gestation. So to me, that's just a modern version of the junk you used to hear decades ago about, oh, it's just a clump of cells. It's your son or daughter.
That's what I try to say too. And when I have someone saying, you know, oh, my daughter or I would never make my daughter go through that. If your daughter got raped, what would you do? And I say, well, that would be my granddaughter or my grandson. And I try to like make that a reality for them. And Seth Dillon was on Joe Rogan recently, and they had a little bit of a pro-life conversation. And that was something that I wish you would have said, like, well, you're talking about if your daughter was raped, we have no right to keep her pregnant, but we need to make people realize, especially parents, well, that is your grandchild, and that is your flesh and blood as well, because that's your bloodline that we're talking about. Back to the actual abortions, I posted on my Instagram stories and asked people if they could ask you anything, what would they ask? Obviously, I'm assuming you've probably seen Unplanned, Abby Johnson's film.
I was in Unplanned.
Correct, you were. I forgot about that. Yeah, I'm so sorry. I'm so sorry. Okay.
I can tell you all kinds of unplanned stories.
And this is when I should obviously make sure that I have all my notes. I was like writing down so many questions. Literally, I usually have 8 to 10 questions for people because the conversation can go any which way.
Yeah, I was doctor number 1 in the credits.
So then, is that what happened in that abortion scene where the baby kind of pulls away? Is that accurate?
Well, I don't know that I didn't. You know, the babies move. You can say that the baby tried to pull away. That idea that the babies are consciously trying to pull away from the suction machine, I don't know. I wouldn't render an opinion on that. Babies move, starting at about 10 weeks from the last menstrual period. What they were using, they were illustrating, that was all CG, of course. No actual babies were killed in the production of the movie. There was around 11, 12, 13 weeks. And babies at that stage move pretty actively. And I saw the scene as, the baby was moving and then they sucked it out. I didn't necessarily interpret it like the baby was trying to get away. I think
Okay.
that's a bit of a stretch.
But do they, okay, so I guess maybe this would be more of an accurate question. Do they move more when they're poked or prodded?
A little difficult to say at that stage. Babies do move actively, and this starts getting, now we're going to get into the whole thing about fetal pain. Um, I did, when I was doing in my training, and I did second trimester abortions, D&E, the one that I described pulling the baby apart, that hadn't even been invented yet. And we used to do what are called saline abortions. They're not done anymore. But what you would have to do is put a needle through the lady's abdomen into her uterus, draw fluid out, as much of the amniotic fluid out as you could, and substitute 20% salt solution. That 20% salt solution would burn the baby, kill it, and eventually cause labor. Um, you've got a needle inside the sac where the baby is. Okay, I mean, these kids are like 15, 16 weeks, and you've got a needle, and you can't really see where it's going. You do it all by feel again, and there are times you were sure that you stuck the baby with the needle. I mean, you could feel it. It's like a fishing line almost. I'm telling you, you can feel it. And those cases, you could feel the baby pull away. I had that happen more than once.
Yeah.
So, are babies sensitive at that stage? Sure. Babies can feel, babies move, babies can hear, especially at later stages. I had a friend, she'd had a real infertility problem and she was pregnant finally. And when starting at around 10 weeks before she delivered, around 30 weeks, she would take headphones, clamp them to her stomach, turn the volume up, and she would play soothing classical music to her baby. It's just something she did. After the
Yeah, I
baby was
love that.
born, if the baby was fussing or acting up and wouldn't settle down, she would take that CD, put it on, baby go right to sleep every time. Babies are sensitive. Babies have functioning brain, spinal cord, and neural system. How do I know that? They move. You have to have a functioning brain to do that, and that starts at 10 weeks.
Of course, and that's something the other side doesn't necessarily want us to know because then people see the humanity of the baby. And then once you see the humanity, it's a lot harder to sell someone an abortion.
Here's the harsh reality of that. Do they know that babies move? Yeah. Do they realize from practice that these babies are sensitive? Yeah. Do they know that babies probably feel pain when you're tearing them apart? Yeah. They don't care.
I know. It's so
I know
sad.
people always, oh, the baby's heart's beating at, 28 days. Yeah, it's true. I've got a great ultrasound on my computer that I did at the local pregnancy center that my wife and I helped start. Lady with twins, 29 days from conception, and they got 2 sacs and 2 beating hearts. I mean, but do they care? They don't care.
Yeah, I think the average person probably would care more about these things and the baby responding to pain and whatnot, but obviously the people who are profiting off of ending their lives don't care because
Sure, but you as
that's
a
irrelevant.
pro-life person don't have the press acting as your propaganda core like the
This is true.
pro-abortion side has.
This is true. I say all the time, if we had more education for people, then I think a lot of people would change their minds. For instance, here in Colorado, we tried to pass a bill. I work sometimes with people who do things politically, where all that would be required in sex ed, and it wasn't a pro-life or a pro-choice bill, was that in sex education, you show an ultrasound. That's it. You don't, not necessarily a woman coming in the classroom to do the ultrasound, but just you show an ultrasound to show the development of the baby. And I won't say R or D because I'm not supposed to say that. We're a C3, but the people who are typically on the pro-abortion side completely voted it down, which was so telling to me of what they really think and how they feel. Because I'm like, this is informed consent. This is just education. This is science. This isn't even there's no motive or agenda. I mean, I guess in the sense of most people choose life once they see the ultrasound. I mean, that you could consider that motive, but it was just bizarre to me because I'm like, okay, you guys are now saying the quiet part out loud because you don't want girls to see an ultrasound to see the humanity of their own baby and what stage it's in. It's disgusting.
You're absolutely right. And see, it's been shown again and again. After viewing her baby on a television screen in an ultrasound, the pregnancy isn't just some vague thing anymore. You can see your son and daughter on a screen. The majority of patients will walk away and don't want to have an ultrasound. And interestingly, the data shows if the dad sees the image, even more people won't have ultrasounds. But, Like
mean
I said,
abortion? Won't have
I
abortion?
don't have the national press as my propaganda corps. It sure would be good if I did.
Wouldn't
The
it?
person that was most influential in getting me involved in pro-life many, many years ago, he once said, if we had the national press on our side, abortion would end in a year. And I believe him.
I do too. Without a doubt, I do too. I know so many young people, and I think right now, one of the biggest culprits is comprehensive sex education because it's manipulating young girls to think that it's not a baby, that they don't understand the development of their child. They're told basically that abortion is like ripping a Band-Aid off. And that's like what we're raising up, and that's what's in public schools, and that's what, millions of kids are learning. I think that's if we had something that could at least tell them the humanity of a baby and, that you don't have to have sex, that I think we would be a lot farther along. And obviously, if we had the press helping us, we'd be a lot farther along as well. So I had a couple questions that I got on Instagram. Somebody asked, what happens to the baby after the baby is removed from the mother's body?
Once a baby is removed, technically it's just medical waste. So if the baby is in New York State, I'll talk about because that's when I do my abortions. In New York State, if the baby was less than 20 weeks at the time of the abortion, it's just tissue. It's no different than I took out a piece of your liver. It goes down to a lab. The products of conception, i.e. the pieces, are, checked, a pathology report is issued, and then the medical waste is disposed of, typically by incineration. That's what happens. In New York State, if you did an abortion after 20 weeks, really interesting, abortion's perfectly legal after 20 weeks in New York, still is. But
yeah, Colorado too.
If it's more than 20 weeks when the abortion occurs, you had to have a funeral.
That's not true anymore, is it? Is
I haven't checked the law in New York for a while, but that was the way it used to be. You had to, and every abortion, every single abortion in New York State has to have a fetal death certificate filed. That's the law, still is. And at the time, if a pregnancy was lost after 20 weeks for any reason, as I said, typically they would be looking, this is different. After 20 weeks, it was different under the law. Now, I don't know. You're right. I have not checked New York State recently to see if that's still in effect.
I'll have to look that up. I'm so interested, and I'll put that in the notes for people who are watching, like on YouTube or Spotify. If you're listening, I'll try to look that up and put it in the notes to see what the current thing is. I didn't know. I'm curious now if here in Colorado, if we have to do a fetal death certificate, or if we had to do that at any point in time. Somebody else asks, what happens if the baby survives the abortion?
That's a great question. That's a really complicated one. Depends on where you are. This gets into the whole legal thing about why abortion is legal. Why is it allowed? Christine, are you a human being?
I am, yes, sir.
How do I know?
I guess I don't know how to answer the question.
Well, the answer is I'm a human being, and you know that I'm a human being because I'm an animal that looks this way and has 46 human chromosomes, blah, 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 okay? In other words, I'm a human being by scientific definition. This is what a human being looks like. Just like you can identify a dog.
I felt like Ketanji Brown Jackson there for a second when you said, what is a woman? And she couldn't answer what a woman is. And you're like, what is a human? I'm like, okay,
that's a different
I feel
question.
Like that right now.
That's a different question. Now, Christine, are you a person?
Yes.
How do I know?
I'm Ketanji Brown Jackson again.
Or, let's put it a different way.
How do I answer this?
What is the difference, if any, between a human being and a person? Is there any difference between the two?
I think the other side would potentially say consciousness. I'm not sure.
Nope.
I mean, to me, no.
There's a very big difference between a human being and a person. I have a law degree. In law, there are only two things in the entire universe: persons and property. That's it. Everything in the universe can be classified as persons or property. Okay?
Interesting.
What does a human being, as I said, is a scientific definition. But you are a person by virtue of law. That's not the same thing, meaning you have rights. That's what makes you a person.
Gotcha. I feel like I need to go back to school.
Has there ever been a time in our country where human beings were property?
Yes.
Yeah, everybody knows slavery. They were still human beings. No one argued about that, but they were not persons. They were property. Okay?
Yep.
So when you get into that question about, and then the next question becomes, when did you acquire your rights? When did you, Christine, get your rights as a person? And the answer is, by law, when you were born. So you see, before you're born, according to the law, you're just property, and you can be dispensed with just like any property can be dispensed with. Once you're born, you're a person, and I can't even touch you without your permission because you have rights. That's the argument you start getting into from a legal standpoint about the two things. Now, tell me again what the exact question was.
If the baby survives an abortion, what happens?
Oh, if baby survives. If a baby survives an abortion and is born and is alive, that's why I got into that. That baby is now a person under the law, under the Constitution. And that baby has rights. And one of those rights is to health care. Okay? So if a baby's born alive, that baby needs and should get medical care. Now, that's kind of a conflict when somebody's paid you good money to kill their son or daughter, and that's what an abortion is, and that's what you do. You pay money to have somebody kill your son or daughter, like it or not. And that baby's born alive, that's kind of a problem, okay? And there have been cases where babies have been simply left on tables or neglected and died. This shouldn't even be an issue. I mean, that we shouldn't have to have the Born Alive Infant Act in the Congress or something. When a child is born under the law, under abortion law, that child is now a person and deserves care. Period.
I agree. Did you ever see a situation where a baby survived the abortion?
Not personally, no.
Is that because the abortions that you performed involved dismembering them?
Yeah, when I was in training, we used to do those saline abortions. I mentioned that, and it was possible. There was one birth at our hospital of an infant who did survive the saline abortion. Jana Jensen is somebody who did that, if you know the name.
Yeah, I do.
I heard there was one case of a baby that survived in our hospital. I wasn't involved in that particular case. All the ones that I did children were dead. And of course, when you do a D&E abortion, there's no chance that they're going to survive.
Yeah, of course. So we have a couple more questions that people asked on social media. Is there any follow-up care for like your situation? Obviously, you had an OBGYN office, so they came back in for whatever reason. So that might look different, but maybe kind of how it works at Planned Parenthood for those women, and you touched on it a little bit before. Is there any follow-up care for those women?
It's a little scarier today now with medical abortions. With RU46, because I can get on a website, answer a few questions, they mail me the abortion pills, and the person that mailed me the pills is in maybe New York State, and here I am in New Mexico. I'm never going to see that person. What kind of follow-up care am I going to get? That's not good medicine, in my opinion.
So speaking of that, if someone is taking the abortion pill, maybe obviously if they're sending it to them from New York and I'm in California or something like that, prescribing it in that way, they can't do an ultrasound. If the woman has an ectopic pregnancy, is it unsafe for her to take the abortion pill?
Absolutely. The abortion pill is contraindicated, according to the FDA, in cases of ectopic pregnancy, tubal pregnancy. Ectopic pregnancies are not that uncommon, and they can cause serious complications, including death of the mother. I've seen and treated hundreds of ectopic pregnancies over the 40 years that I worked. And the only way you can diagnose, it's really funny because the REMs, the restrictions that FDA puts on the use of Mifeprex or of the abortion pill, they were modified just a week ago on January 3rd. But they still include that no patient with an ectopic pregnancy should be given the abortion pill. It also says that a certified physician who uses this medication must be able to accurately determine the patient's length of gestation. This is important. So if you and I mean, I'm seeing you on a video screen right now. Let's say I was an abortionist and you were looking for an abortion, and I'm going to sit there and go, well, when was your last period? Well, you may give me a date, or you may say, gee, I don't know. I have irregular periods. If you were in my office, I would do a physical exam and estimate the gestational age of your pregnancy. And if I had any doubt, or as I said, when I was doing abortions, every patient got an ultrasound. Why? Because I need to accurately know her gestational age, and I have to make sure that she doesn't have an ectopic pregnancy. If I'm looking at you on a video screen, there is no way that I can diagnose whether or not you've got an ectopic pregnancy. No way at all. And if I mail you abortion pills, I may be putting your life in serious jeopardy. There's another problem. If you have an Rh negative blood type, you need a shot of something called Rogam after the abortion is done to prevent you from becoming sensitized to Rh, which can then endanger a future pregnancy. There's no way to do that on a video screen that I know of. So the FDA says it's kind of I'm going to use a serious term, it's two-faced on the part of the FDA. Right in their restrictions, the new ones that they put out just last week, a provider must be able to accurately determine gestational age. You can't do that on a video screen without a physical exam and maybe an ultrasound. Has to be able to rule out ectopic pregnancy, cannot be done on a video screen by looking at somebody and asking them a few questions. Must be capable, and these are their restrictions they just put out last week. Must be capable of providing surgical intervention should the medical abortion fail, or have an arrangement with a local doctor to provide such care. None of that's possible on a video feed. They say all that in paragraph 15 of the new REMs. In paragraph 16, then they say, well, it's perfectly okay to dispense RU46 by without a visit. And we aren't going to tell people, we aren't going to tell providers, not doctors, providers, how to diagnose ectopic pregnancies or determine Rh. We're not going to tell them how to do that. We're going to tell them they have to do it. But in the next paragraph, it's perfectly okay to do it on a video screen. So this is inconsistent of FDA, but these are the brand new regulations that came out a week ago.
That's not even possible to do. I mean, what does a woman do an ultrasound on herself via video? I mean, like you can't even diagnose it via video screen.
Go back to what I said before. They don't care.
Yeah, you're right. It seems so common sense to me and so logical that you would have to actually check that. For so long their talking point was it's between a woman and her doctor, but then we're seeing this that you don't actually need a doctor to have it. And you kind of just touched on it here. Would you say, obviously, if a woman is taking the abortion pill via mail or however she gets it these days, because they're trying to make it more accessible, and she is 15 weeks along, but the doctor doesn't know and can't tell, what can that do to the woman?
Well, there's nothing new in this. Years and years ago, when I was in the pro-life movement as part of a pro-life group, we called our local Planned Parenthood after hours, and you get a recording, such and such and such, the office is closed. If you're having an emergency, go to the emergency room. Okay? This is called, in medicine, dumping. Okay? You've collected money, either performed a procedure, or in this case, handed out a drug, and then the minute the patient has a complication, dump it. Make it somebody else's problem. I'm in Las Cruces, New Mexico right now. I teach at a medical college here. And I practiced here for 16 years before I retired. And for a period of 3 years, I was a chief of staff of one of the local hospitals. And there were no abortionists in town at the time, and then suddenly an abortion clinic opened in our town 2 blocks from the hospital. Here I am, chief of staff, and they're doing abortions up to 18 weeks. Okay? They're doing D&E abortions, the one I described, up to 18 weeks. I'm chief of staff. I'm waiting to get the applications from the doctors requesting medical privileges to join our medical staff and take care of their problems. Never showed up. They never talked, and I checked with them. They never talked to any of the local OBGYNs. They never made any kind of transfer agreement with anybody. If there was a problem, they would dump them into the ER. And that's exactly what, as far as I can tell, the majority of these sites are simply going to do. You got a problem? Go to the emergency room. And
Oh,
who
that's
cares
so
what the
disgusting.
FCA says about my responsibility? They
Right. They don't care.
don't care.
Which goes, it reminds me of the Hippocratic Oath that to do no harm. They're obviously doing harm if there's an issue and then they just dump it on somebody else. I don't feel like they're upholding that do no harm thing. I mean, of course, they're already killing a baby to begin with, so I suppose they don't
That
have
is
much of a
poor care.
concept.
And forget abortion. If you had, you need your appendix out, and 3 days after you went home, you've got a fever of 103, don't you want to be able to call the doctor who took care of you and say, hey, I got a problem, please take care of me?
Of
It's
course.
a basic medical right. But in this case,
I
they don't care.
You're right about that. Okay, a couple more questions that the Instagram had because I think it's so fascinating, some of the stuff that they're asking, which are actually really great questions. Are there long-term effects to abortion? I'm assuming there probably are. Can it be harder for a woman to conceive after she's had an abortion? You've seen patients after their abortions because you had an OBGYN office. Did you have women who had difficulty conceiving after abortion?
A lot of doctors who are on the abortion side would argue about this with me because there has been a very, I think, a powerful effort to create peer-reviewed journal articles that state that there are basically no serious or very, very few serious complications that occur with abortion. There's no such thing as mental health problems after an abortion. There's no, there are only very, very, very rare serious complications of abortion. The reality is that abortion does cause serious problems, and that that there is a lot of literature out there that points that out. One of the strongest associations in the medical literature that is that, and there have been over 130 studies that showed it, was that women who had abortions have higher rates of preterm birth late in subsequent pregnancies. This has been acknowledged by some medical associations in the world, but it's amazing how I hear so many physicians are so certain there's no association with breast cancer. There are some studies that say there isn't. There are lots of studies that say there are. And I think the proper response in the abortion breast cancer argument in medicine would be, you know what, we're not 100% sure because we've got conflicting studies. We need more data to make a determination. Rather than saying, oh, it's a settled question, there is no such thing. Boom. That's what they do. The other thing, too, is
What is your opinion on that?
a lot of studies that you hear are based on American data, but the problem with American data is not very good. Numbers of abortions aren't even reported. 4 states, including California, which has the majority of abortions, of more abortions than any other state, don't even report their numbers to FDA.
Yep.
And then they do research studies based on American data. The best data, frankly, comes out of Europe, and believe it or not, out of Finland. I can't get into it now because it goes on, but there is a lot of data in places that have government-paid insurance with really scrupulous record keeping, which are much better because at least you've got a good accounting of who had abortions and then what happened to them afterwards. We don't have that in the United States. So there are studies going each way, and anybody who's worked in a crisis pregnancy center or pregnancy assistance center knows that there are people that really struggle with their abortion decisions afterwards. There are medical studies out there, especially in some of these other countries where the record keeping is better, that shows that a woman's chance of dying for any cause is higher after she had an abortion compared to somebody who had her baby. There's all this data is out there. There's tons of it. But they deny it because they don't care.
That's like a common theme. That's probably should be the title of the episode. They don't care.
It should be. They don't care.
What are some of the actual side effects that women can? You mentioned some of the ones that I think it was with the pill we were talking about. Obviously, I believe uterus can be perforated is one of the things. Women can become infertile from abortions, right? Is that accurate?
It's possible, but that's a rare complication. When I was doing, especially the second trimester Dini abortions, in a surgical abortion, there's a risk of infection. There's a risk of bleeding. there's a risk of perforating the uterus or damaging one of the internal organs around the uterus. The bladder and the rectum are very close to the uterus, and they can be damaged in an abortion. There's less chance of that with a medical abortion because you're not instrumenting the patient. But infections still occur. Hemorrhage still occurs, sometimes requiring transfusion. I did a case, and remember I said, and there's so much emphasis about, oh, you don't need general anesthesia, you don't need to be in a hospital. I would never do, even if I were still doing abortions, I would not be doing them in an outpatient clinic. Sorry, that's beyond my comfort level. I had an abortion I was doing, second trimester abortion, 18 weeks in the hospital. And I told you reach in with a clamp and you pull out the arms and you pull out the legs. And I reached in, everything felt normal, and I pulled it out, but what I had in my clamp wasn't a baby piece, it was the lady's intestines. I had perforated the uterus, grabbed her intestines with the clamp, and dragged them out through the uterus, through her vagina, to the outside. Now, this lady is in a hospital, in a sterile operating room environment, asleep with an anesthesiologist at the head of the table. Now, I got to ask those people who don't care, what the hell are you going to do when that happens in your outpatient clinic that's not in the hospital? What the hell are you going to do? In this case, that's a serious complication, but she's asleep on an operating table. She's in an operating room. I get on the phone, says, hey, Jack, my surgery friend, could you come in here? I perforated the uterus and damaged the bowel. He came in, we fixed it, we finished the abortion, she was fine. What the hell are you going to do when you're sitting in some outpatient clinic and that happens to your patient's awake?
Did you tell her that happened once she woke up, or was that something you just...
Yeah. When you make a mistake or when something happens to a patient, the most important thing you can do is be honest with the patient, tell them about the complication, make sure they understand that you recognize the complication right away and you fixed it. That's just, you have to do that.
I appreciate that about you. I can imagine people who are, ending the lives of babies may not always have the most conscious, what's the word I'm looking for? They might not always necessarily do the right thing. For instance, Warren Hearn, I'm sure you've heard of him here in Colorado, is a late-term abortionist here. He thinks humans are a cancer on the planet, and I'm sure that's a climate change or climate activist type thing. But he doesn't seem like the most honest kind of person. For instance, I met a woman who used to be a nurse in his office years and years ago, I think in the 80s. And she said there was a time where a baby was born alive. I want to say maybe 16 weeks. I could be wrong. But I remember very vividly, she told me the baby was born alive and he just snapped the baby's neck to make sure that the baby was dead.
Warren Hearn literally wrote the book on abortion. I never personally heard of any case where Warren Hearn did a thing like that. That is what Dr. Gosnell did in Pennsylvania, though. And Dr. Gosnell is in prison for the rest of his life for murder.
Yeah, I don't think that he would ever advertise that, obviously. This was someone who used to...
I've never heard anything about Dr. Hearn having been involved in that. So, but Dr. Gosnell, it was well documented that that's what he was doing. This gets into that whole thing about, we need abortion to save women's lives. I've done almost every type of practice there is. And for almost 10 years, I worked in the medical college where I had graduated from years before, as on the staff on the OBGYN staff at that hospital. And we were a tertiary referral center, meaning our hospital was set up to take care of the most severe pregnancy complications. Pregnancy can be dangerous. Everybody knows that. That's reality. And in those 10 years, I saw it all. Cancer cases, decompensating heart problems, severe out-of-control diabetes, severe out-of-control blood pressure. These were life-threatening situations. There are times when pregnancy will threaten your life, period.
Wow. I could literally talk to you for so long and just continue to ask questions just from a place of wanting to learn more and see what you have seen, obviously, because we hear from both sides of the aisle. The pro-life side says one thing, and obviously I side with them, and the pro-abortion side said something else. But to be able to talk to somebody who's been in the room, who has provided over 1,200 abortions, like you have said, knows exactly what's going on, it's so much better to talk to somebody like you, because I do often have people say, well, what's your medical degree? Have you ever done an abortion? You don't know what you're talking about. And now I can say, hey, I've talked to somebody. Go listen to this podcast episode. Are you on social media at all? Can people find you on social media, or are you off of social media? Do you have a website? Where can people find you if they want to look?
Yeah, you're going to laugh. But it's so funny because this question, as I said, I teach in a medical school, and this question came up in a lecture I did just last week. I am not on social media. I do have a Facebook account, and the only reason I have it is because my wife bought me one of those Meta Quest things you put on your head, and you have to have a Facebook account to use them. I never have posted anything. I never will. I am not on Instagram. I am not on Facebook. And I am absolutely positively not on TikTok, brought to me by the Chinese Communist Party. So no, I am not on social media. I never will
So
be
somebody
on
has to
social
sign
media.
up for your class in New Mexico to come find you.
In my opinion,
Basically,
to all
that's
those
where
folks watching, you are nuts to be on social media. But that's just me.
I know, I agree. I have such a love-hate relationship with social media, but oftentimes that's where the young people are, and that's where I can reach them and kind of put this information out, and
Well,
people
I
need to see this
understand.
information. And so it's a love-hate thing. Like, I can't stand it, and it's addicting, but then also it can do so much good at the same. It can do a lot of harm, but can do a lot of good
Do
too.
you know what the bottom line is here? I don't care.
Now you don't care.
That's right.
Okay, so something that I end every episode with and ask all of my guests, if you could encourage somebody to speak out, people who are a little bit hesitant, a little bit nervous to talk about their pro-life beliefs or anything that's near and dear to them, what would that one piece of advice be?
Arm yourself with as much information as you can. There is tons of information out there, and even though most of them don't care, facts are still your most powerful weapon. And go to the American Association of Pro-Life OBGYNs has a website that is loaded with this stuff, and they do hard science papers about the effect of abortion on health, preterm labor, all that other stuff. And when you arm yourself with the facts, you'll win almost all the arguments. The other piece of advice would be cut through the language and follow my lead. When somebody talks about their fetus or their embryo, remind them that that is their son or daughter. I've faced many patients over my career who were fighting and struggling with the idea of whether or not to abort their child. And I would tell them something that's very important because, and I know, and I say this knowing what I said before, there are very strong forces pushing women toward abortion sometimes. And you cannot ignore those things. But on the other hand, I know you're worried about your education, and I know you're worried about your finances, and I know you're worried about your future, and I know you're worried about your relationships. But ultimately, you and only you can give your son or daughter something that no one else can give them. And that is the chance to live and enjoy life just like you do.
That's so beautiful. I love that. Is there anything at all that I missed that you want people to know? I feel
Well,
like
I'll
I
tell you
asked a
what,
lot of questions.
if you think of something you missed, email me and we can always do another segment.
I appreciate your time. Thank you so much for joining us.
My pleasure.